Hi, my name is Jordan Greenhalgh, and I'm a student physical therapist with the University of St. Augustine for Health Sciences. Today I will be presenting a case study about a patient who's currently a student with lower back pain and the interventions that could be used to treat this population and similar populations. In 2017, Ashelin and Ashton published this article in the European Journal of Orthopedic Surgery and Traumatology that found that there is an increased rate of lower back pain in health science students. The risk factors that they found to be the most associated with lower back pain in this population included excessive hours spent using a tablet or a computer, uncomfortable college furniture, using a heavy backpack, and feeling overwhelmed. My patient in this case was a 23-year-old occupational graduate student with a chief complaint of general chronic lower back pain that began 4 to 5 years ago, around the time she started her undergraduate degree, that she attributes to the increased amount of time spent sitting in class and studying at home. She said it becomes worse when she sits or when she has prolonged activity and towards the end of the day after studying all day. She reports her pain at worst as a 4 out of 10 on the National Pain Rating Scale, which is a scale from 0 to 10, with 0 being no pain at all and 10 being the worst pain they've ever experienced, which was shown by Wright and Cook in the Physiotherapy Research International Journal in 2013 to be a valid and reliable scale for patients with lower back pain. She stated and pointed to the location of her pain from being between L1 and L5, with the worst pain located at segment L3-4 in the center of her back. She reports that her pain is reduced by taking ibuprofen and laying down to rest. Her past medical history was unremarkable, and she denies taking any other medications. The patient completed the Austrian Low Back Pain Disability Questionnaire, which is a self-report questionnaire with 10 questions about how the patient's back pain affects their ability to manage everyday life and their permanent functional disability. This was shown to have moderate and high validity and reliability by Jones et al. In the Science Direct Journal, published March 2019. Her scores in this case indicated that she has minimal disability and can cope with most living activities. The Fear Avoidance Beliefs Questionnaire, which is another self-report questionnaire with 16 questions about the beliefs of how physical activity and work may affect her back pain, which was given to her. This was shown by Trinderup et al. In BMC Musculoskeletal Disorders Journal in 2018 as a valid and reliable measure for predicting pain behaviors. On this questionnaire, she scored a 17 out of 96 possible points, indicating that her current level of back pain is not preventing her from performing normal activities. Her stated goal during the evaluation is to be able to work through her pain at school and in her future career, and to be pain-free when sitting for extended periods of time. She walked into the evaluation without any gait deviations and is of slender build. During the initial observation, it was observed that the patient presented with forward head posture, an increased angle between her ASIS and PSIS, and a reduced thoracic kyphosis and lumbar lordosis. Other than the previously stated deviations, there were no significant deviations in any of her posture or anatomical landmarks. Her active range of motion was shown to be decreased for flexion, extension, bilateral rotation, and bilateral side bending by about 25% in all directions. During palpation, there was tenderness noted over the L3-L4 segment in the middle of her back. Passive mobility testing showed a decrease in motion at the segments L2-3 and L3-4, and an increased movement at L1-2. All other passive mobility tests were unremarkable. Additionally, her neurovascular upper quarter, lower quarter, and SI screenings were all negative. The prone instability test, which is performed by having the patient bend over the table while the therapist adds pressure over the spinous processes throughout the lumbar spine until pain is felt, after which the patient lifts her legs, and if pain is reduced, this is a positive test. This test is used to indicate whether the patient would be a good candidate for a stabilization program. In this case, the patient had a negative prone instability test, indicating that she is not an ideal candidate for a stabilization program. For this patient, the prone instability was negative again. The length of the 1 and 2 joint hip flexors was evaluated and showed that there was bilateral tightness of the iliopsoas muscle. Finally, the double leg lowering test, which is done by having the patient slowly lower their legs while laying on their back and slowly lowering their legs from 90 degrees until they are unable to maintain correct posture, was done and showed that the patient had decreased strength in her abdominals. The physical therapy diagnosis for this patient using the International Classification of Function is lower back pain with mobility deficits due to the decreased movement in segments L2-3 and L3-4, which is contributing to the increased movement of L1-2. She has a good prognosis and she is young, motivated, and has no other comorbidities. However, she is still expected to sit for extended periods of time due to still being in school. Her long-term goal is to decrease her pain in 6 weeks to improve her ability to sit in class and study. Her impairments and the interventions to treat these impairments in hierarchical order are as follows. First is decreased movement at the L2, L3, and 3-4 segments, which will be treated by manual manipulation. Manual therapy was shown by Olger et al. In the Journal of Back and Musculoskeletal Rehabilitation in 2017 to be just as effective as exercise stabilization programs and to be even more effective on treating pain and functional deficits. Next, I would like to treat the increased movement at segments L1-2, which will be treated by strengthening the back muscles with an emphasis on the multifidus. Kaizen et al. Demonstrated the effects of a stabilization program to strengthen the multifidus in the Journal of Back and Musculoskeletal Rehabilitation published in 2015. Next, to address her forward head posture and poor sitting posture, I will use patient education and posture correction exercises. Kim et al. In the Journal of Physical Therapy Science published in 2015 found that using posture exercises reduced not only back pain but also any shoulder pain prevalent in college students. Next, the weak abdominal muscles will be treated with strengthening exercises and breathing exercises. In an article published in the Journal of Physical Therapy Science in 2016, King et al. Demonstrated the use of exhalation exercises in addition to stable exercises using the draw-in maneuver, which is performed by having the patient lay on their back with their knees bent and feet either flat on the mat or table. As they exhale, they draw their abdominal muscles towards their spine, and this has been shown to help increase the activation of the abdominal muscles and the erector spinae to decrease back pain. Finally, I would address the tight bilateral iliopsoas muscles by stretching it to increase their length. This case study of a 23-year-old graduate student is a good example of impairments that may be present in other graduate students and other populations that sit for extended periods of time and may be contributing to their lower back pain. These also show how these impairments might be treated using an evidence-based program. Thanks for your time and attention. Are there any questions?